Hey y'all, Azim here. We are going to go over some of the smaller, more specialized bones of the head and neck region, the auditory ossicles and the hyoid. So auditory ossicles, they're the smallest bones in your body. You can see them right here. Get a nice close-up there. Yeah, there we go. So these are really small bones found only in your middle ear. We'll go over the ear later. There are three portions of the ear that we've divided up into outer, middle, and inner. But these are found in the middle ear. They're called the malleus, incus, and stapes, named after what they look like. Malleus looks like a mallet, like a little hammer. Incus looks like an anvil, you know, the thing you use to make swords or drop onto roadrunners. And a stirrup, like when you get into a horse, you put your foot in it. You can put your foot in that little thing. So you've got three on either side. So three on the left, three on the right. These bones are really important because they help with vibration. All hearing is, the way we hear is we have sound waves coming into our ear. So here's our external acoustic meatus. Here's our external acoustic meatus of the temporal bone. Sound waves come in, which are just pressured waves of air that vibrates our tympanic membrane. You probably know it as the eardrum. Then it vibrates the first bone, that's the malleus. Then it vibrates the next bone, that's the incus, and then it vibrates the next bone, that's the stapes. And then the stapes vibrates this big weird contraption, this snail-like contraption. This is called the cochlea. And the cochlea is the organ of hearing, and we'll get into all that later. But these are an important middle intermediate to allowing sound transmission get to this organ of hearing, the cochlea. Here's a bigger view of those bones. Here's the malleus. This is the most lateral. Incus is intermediate. Stapes is most medial. You can see how the malleus looks like a mallet. It's mallet shaped. Incus shaped like an anvil. Stapes shaped like a stirrup. Malleus is lateral, incus is intermediate, stapes is medial. So you need these bones to hear properly. If you do damage these bones, that is one way that you can get conduction deafness. There's several ways that you can have impaired hearing, but that's just one of them. One more bone that we have here is the hyoid. The hyoid, completely separate. You find this just on the superior part of your larynx. The hyoid has some, we'll just name some parts. So the main part is the body, and then you've got a greater horn, which points out posteriorly, and a lesser horn which points a bit superiorly. The hyoid is the only floating bone in your body. Floating meaning it does not directly articulate with any other bones. It is connected with ligaments and tendons, but there are no bones that immediately border it. The advantage of that is that it has high mobility, and by moving around a lot, that means it can help your tongue move around a lot because it's attached to the tongue superiorly. It can help your throat move around a lot so you can swallow better. The hyoid is important for both of those things. And let's go take a look at where it is in the context of our bodies. Here is the hyoid bone. You can see the little lesser horn right there. This is the thyroid cartilage of the larynx. This protrusion here is that bump that you feel that you call your Adam's apple. So it's superior to that. It's pretty high up. It's kind of hard to feel. You'd have to really push into your neck to feel it. But this is where it's located. It has attachments for muscles to control the tongue and to control swallowing.